slide down just a little bit to have room for the minister.
Yeah,
Please.
slide down a little bit. And that way a little bit.
Yeah, because she's gonna wanna be right in front of the
Are we
podium.
okay?
I think you gotta go this way a little bit.
This way.
Yep.
Okay.
So the minister's gonna stand right here.
Why did you
from
put
what I
tape on
understand.
the floor like that?
Hi, ladies and gentlemen. We're going to get started. Thanks so much for your patience. We're going to get started in about 2 minutes. Okay, in the meantime.
This took a lot of time lining us up.
Yes, this
We've
is not
used
what we
2
talked
rolls
about.
of tape already.
This is not what we talked about.
No.
Okay, so I'm going to have you guys actually move over here.
You guys actually move over there.
Okay. Colonel Deming
So we just flex.
here, Dr. Oglava, and then actually,
Neil, come here.
yes, perfect.
We'll go there.
Yes, and then actually, I'll have you come forward.
Okay.
And,
Don't put this on national news, okay?
Get it out there, get it out there.
and then, from a local perspective, stand over on the other side.
You want us over there?
No, just
From the
saying.
biggest local would be Mayor Harris. You ended up where we started from.
I know where I belong, it's all right. Right?
Yeah. That's right, 10 days. Do you need this? Because I'm speaking for her, right? Well,
I will be introducing you, but my notes are underneath, so I'll move them after that.
yeah, one toss, that'd be funny, 'cause it looks the long time frame. We are going over here from this region, so. Ally's Crossbow Foundation. Yeah. This'll be our sixth one.
I'm gonna have to do that.
It's nice because as opposed to
Hope somebody's here that can drive an ambulance.
we just get together. So, whereas when you go to a resort here,
We did Hawaii.
Sure, get it. Oh, did it disappear?
Everything was in there.
You really did.
I thought you were giving autographs to me.
No extra charge?
ready to become dads. We'll do that.
That's it, mess them all up, that'll really fix it. Throw them all, throw them in the air, see where they live.
Well, it's good. But
Good to go, thumbs up.
So, just go ahead.
Good morning, everyone. I'm Dr. Piotr Glaza, Medical Officer Health and CEO at Hastings Prince Edward Public Health. Hastings Prince Edward Public Health has been pleased to support the recent repatriation efforts for Canadians and their families traveling from areas affected by COVID-19. The proactive national, provincial, and local response to COVID-19 truly demonstrates the importance and necessity of a strong public health system at all levels. We at Hastings Prince Edward Public Health are honored to welcome our partners here today as we work together to protect and promote the health of our communities. Today we welcome the Honorable Patty Hajdu, Federal Minister of Health, and Colonel Ryan Deming, Commander of 8th Wing Trenton. I'm now pleased to invite Colonel Deming to the podium.
Minister Hajdu, Member of Parliament Ellis, Dr. Oglaza, Mayor Panchuk, Mayor Harrison, ladies and gentlemen. For the past 2 weeks, over 150 Canadian Armed Forces members, as part of Task Force Paratus, have been working to support the over 100 members of the Public Health Agency of Canada, Ontario Emergency Medical Assistance Team, the Canadian Red Cross, Canadian Border Services Agency, as well as the Hastings Prince Edward Health Unit, to bring our fellow Canadians home from Wuhan, China, in a safe and dignified manner. I'm proud of our wing, I'm proud of our task force, and I'm proud of the way that our communities have come together to offer support. Not only are those folks that are currently in quarantine at CFB Trenton, but also all those who are working day and night to support the more than 400 guests during their quarantine period. A special thank you to our mayors and our warden for the confidence they have in the members of the Canadian Armed Forces. Their support is definitely an enabler to all that we are accomplishing in this operation. We know it is a difficult and stressful time for all of our guests. The whole of government team continues to strive to make their stay as comfortable as possible while respecting the constraints of the quarantine order. We remain fully cognizant of the potential health risks, and we and our partners continue to exercise rigorous safety precautions to protect our personnel, to protect our families, and to protect our communities. In the coming days, we'll be receiving a plane with Canadians returning from Japan who've been aboard the cruise ship Diamond Princess. The whole of government team is prepared for their arrival and will ensure that they, as well, receive a warm welcome. While they will not be staying with us at CFB Trenton, the Canadian Armed Forces members will once again be providing that essential logistical role to enable their stay at the NAVCAN Centre in Cornwall, Ontario. While Operation Globe and work from Task Force Paratus is still in full swing, I wish to use this opportunity again to thank our communities for respecting our guests' privacy, but also contributing to their welfare through donations and well wishes. I am personally touched by the outpouring of support from our community and business leaders, as well as the Canadians near and far who all want to help. While the nature of the quarantine order itself limits our team's ability to accept all offers, on behalf of ourselves and our task force partners, like the Red Cross, these gestures are taken to heart and are a true reflection of the generosity of our communities and all of you. On behalf of the entire task force, thank you for your continued support.
Thank you very much, Colonel Deming. I will now invite Minister Hajdu to the podium.
Well, thank you very much, Colonel Deming, and to all of my fellow dignitaries who are standing here. The collaboration that Colonel Deming is talking about is so evident in the repatriation efforts at all levels of governance with obviously public organizations and not-for-profit organizations, and we certainly couldn't do it without that collaboration. I want to also thank my colleague, Neil Ellis, the Member of Parliament for the Bay of Quinte, who we've had the pleasure of working together on many things. This is perhaps one of the more unique things that we've worked on together, but it's an honor to serve with him at the level of governance that we have the privilege to be at. So it's a joy to be here with you today on the traditional territory of the Huron-Wendat, the Anishinaabe, the Haudenosaunee, and the Algonquin people, an important acknowledgement of the history of our country. And it's an honor to be with so many public health officials in this particular room. You know, public health is what drove me into federal politics, and whenever I come into a public health unit, I truly feel that I'm at home. I recognize in the warmth of the organization and the passion of the organization that underlying everything they do is a deep deep concern for the health, the safety, and the quality of life of all Canadians. And that is clear here in this health unit as well. And so thank you for the hard work that you do to keep us all safe. Oftentimes, public health is not seen or heard of very much, but they're busy in the background, making sure that we prevent the illnesses that so many people struggle with. And in fact, it's often an unsung service to Canadians. So thank you deeply from the bottom of my heart. I'm here today essentially to see firsthand the incredible collaboration that's been happening at CFB Trenton with the partners that I've mentioned on the ground. And certainly, you know, this has been a big endeavor for Canada. This is an endeavor that we haven't actually been tasked to do for quite some time in the history of our country. And so we've had to sort of make up some elements as we go. And it's because of the incredible professionalism of the members that you see standing behind me and those that are in the audience that we've been able to do so seamlessly. It's because of their ability to actually plan, to organize, to communicate, to collaborate, and to problem solve that we've had such a smooth arrival of Canadians that were in a situation that was quite untenable. You know, I've been asked a lot about the situation in China, and of course I don't have first-hand experience, but those citizens do. And I'm sure when their quarantine is lifted, they will tell you the stress that comes from being under what we know is the largest quarantine in the history of public health, in the recent modern history of public health. Dr. Teresa Tam, our Chief Public Health Officer with the Public Health Agency of Canada, says we've not seen this in the history that we know of here in terms of those quarantine efforts. And so those Canadians were on the front line of something that was pretty scary. And so the warmth that the community has shown, whether it's the collaboration at the political level or the organizational level or individual citizens stepping forward to ask, how can I help, is truly for me what it means to be Canadian. You know, oftentimes when there's a new virus on the scene, when there's this crisis in our community or in our country, the tendency can be that we pull apart. But Canadians continually remind me that what we're really good at is standing together for each other, and that we're stronger when we work together. And when we're able to put aside our differences, small or large, to get through crises, to get through trying times, that's when we're the most Canadian. And that's what I've seen throughout this entire crisis, through this entire situation, is Canadians stepping up to the plate time and again to say, how do I help? Yesterday, I was in Vancouver talking to the Chinese Canadian community there, very predominant community, as you know, a lot of business people, chambers of commerce, not-for-profit organizations, and their overwhelming question, even above and beyond the questions around the nature of the virus and how things were evolving in Canada's forward planning, was how do I help? How do I help the Canadians in my own community? How do I help the people abroad that are struggling? How do I make sure that I'm part of a solution? And for me, that is the most Canadian thing, is that we roll up our sleeves, we put aside our differences, and we figure out how we're going to get through these difficult times. So on behalf of the Government of Canada, I want to thank you all for coming together in these difficult times and for being a community that was willing to ask that question. How do we get through this, as Colonel said, in a way that protects our health, protects the health of Canadians, but ensures the compassion for people that are struggling and stuck in some pretty difficult situations? And we'll keep figuring that out together. You know, we won't have all the answers immediately in terms of what the next steps are, but I can tell you that my department, through the Public Health Agency of Canada and in collaboration with local and provincial political leaders, but also civil servants, are asking those questions about the long-term scenarios, both from a health protection perspective, from an economic perspective. Those are the questions that we need to answer together. But I am extremely heartened by knowing that we will be working on those situations together and that we're going to find those solutions together as a country. And this is a very excellent work that we're doing that will actually help set some pathways for future Canadians that will struggle with, no doubt, other kinds of challenging situations. So thank you again. I'm happy to take your questions.
Mr. Simon Nigley from CBC National News. When you were at Trenton this morning, were you able to actually see or talk to any of the people who are unfortunately having to stay there, and what did they say?
No, my tour consisted actually of talking to the professionals and volunteers that are working on the ground, making sure that their stay is as comfortable as possible. Obviously, those individuals are in various different states of communication with their own families and a variety of other factors. So my focus today was visiting the site, looking at some of the planning that's gone on to make sure that their stay was seamless, and speaking to the many professionals that are putting in many, many hours to make sure that the people that are staying at Trenton are well cared for and are in good shape.
Follow-up question. Can you give us a timeline of when the next plane load of people is coming from Yokohama in Japan to Canada, when it's going to land, and when people might land here, or go to CFB Trenton?
So we anticipate that the plane will arrive later this week. I don't have a distinct date for you. Obviously, there are a number of measures that go into that, including weather, including changes in flight paths, including the process on the ground. But we hope to have all of those folks back in Canada by the end of the week.
Minister Heather Wright, CTV News. There are some Canadians who are frustrated the government didn't act sooner to get them off the ship in Japan. What would you say to those passengers?
First of all, I understand it's an incredibly trying time. I mean, if you can imagine, and the reports coming out of what it feels like to be quarantined on a cruise ship are pretty horrendous for the average person, never mind people that might have other health needs, other considerations. So my hearts are with them. But I will also say that, we sent our medical team to Japan last week to do an assessment of the quarantine that Japan had put into place on the ship, and to do it on their own symptomology. They'll be tested to see if they actually have the virus, and then a decision will be made through the Chief Public Health Officer about the best appropriate quarantine for them, depending on their circumstances. But I will say this, in every circumstance, we'll be considering that particular person's health and the risk of further infection. What we're trying to do as a country is do our global part in containing the spread in Canada, and I will say that I am very proud of the work that's been happening at all levels of jurisdiction to reach that goal together.
Minister Laura Alton with the Canadian Press. Do you have a better sense of how many Canadians are going to be coming back from Yokohama now?
We're starting to get those numbers, but I'm reluctant to give you exact numbers right now because those are fluctuating day by day. There's about 250 Canadians roughly that are on the ship. Some of them have contracted the virus and are positive and are not able to leave. Others we have not been able to establish contact with. So we'll get back to you with numbers as soon as we have a clear idea of who's coming back.
And what will happen to Canadians who choose to stay there, who are not infected?
So again, each situation will be specific to their circumstances. Some people have indicated that they will stay because they have family members that are now ill and they want to stay with their family members. In every case, we will have a manifest of Canadian travelers, and we'll be able to track their travel arrangements as they return. And we'll have more information about that when the numbers when we have a better clarity of who's traveling in which way.
Has there been any progress on tracking down the Canadians who came back from Westerdam who were not tracked as they came to the airport?
We have the manifest list of Canadians that were on the Westerdam, and yes, there is appropriate protocols in place to find those people as they come back to Canada. Some may not be returning immediately, but they'll be asked to have an additional screening process when they return.
Can you just describe what you saw at CFB Trenton, this kind of work that you saw going on there?
Well, absolutely. First of all, incredibly organized. So oftentimes when people think of this, it could feel chaotic to the average person who's just listening to what a quarantine might be like or has no idea of the organization that goes on. I mean, it's a credit to the CAF professionals under the leadership of Colonel Deming that they have experience in obviously supporting large numbers of people to live on a base like that. I was very impressed, for example, by the kitchen planning. planning and the meal planning and how to do that in a way that reduces waste, increases efficiency, and meets some of the specific needs around dietary constraints, working really closely with the Red Cross, who I haven't mentioned yet, but has been an integral partner in terms of the delivery of the supports for people that are in CFB Trenton. I also was able to see people getting exposure to fresh air, which, as you know, is not only critical for their physical health, but is a part of how we actually, we know that the connection to the outside is a strong component of our mental health. And so all of those kinds of considerations have taken place by the planners and by the people that are facilitating the support for those Canadians. And it's really, really reassuring to see just the level of organization, the level of collaboration, the good humor of the people that are actually working, in some cases 12, 14 hours a day, maybe even longer, indicates to me that there is a spirit of camaraderie, and that is really showing in the care that is being delivered to the people at Trenton.
And those people have been under quarantine, they're about halfway through their quarantine now. Did the staff give you a sense of the morale and how those people are doing?
Yeah, so the morale has been high. People obviously have been, relieved to get back to Canada. We have to remember that people that are in these situations are incredibly stressed out when they are, either stuck in Wuhan, as the first sets of Canadians were, or on a ship quarantined for 14 days and maybe longer. I mean, these are very stressful situations. So the planning that went on included the supports for people's mental health, which I think is really critical, and especially when you're talking about keeping people in quarantine for a long period of time. I mean, as you know, this is a powerful piece of legislation, and it does restrict people's civil liberties. So the idea that we have an obligation to people to keep them as well as possible is a very important one, and we can't do that alone. And that has bbeen really facilitated by the multiple partnerships, but in particular the partnerships that have focused on people's mental health. The mayor was telling me about the librarian making efforts to ensure that children have literature online, for example, that they can access through the library. These extra measures that citizens and leaders in the community have gone to are really helping to make sure that they feel loved as Canadians, and that they are willing to endure this as their obligation to keep Canadians well, but also, in a way that respects the fact that we understand that they are in difficult situations. So this is really a demonstration of the generosity of community, really, and the people coming together to say, this is difficult times, but we're here for you. That, to me, is truly the most Canadian thing.
So far, no one has tested positive for the virus at CFB Trenton. Is that still the case as of today?
That is still the case as of today.
And are there proactive testing that's being done, or is it sort of a waiting if somebody becomes symptomatic, then they go from there?
My understanding is that it's based on a demonstration of symptoms. So there have been a number of cases where, for example, someone has developed symptoms of a cold, a child, for example, and then goes for additional testing just to rule out the coronavirus.
Thank you, everyone.
Thank you very much. Thanks again to the entire community. Thank you so much.